Good morning, everyone. Good morning. Good morning. Thank you all so much for joining us today. I'm really happy to welcome you all to this webinar. We are here to talk about some important topics that affect our lives and our communities. We are lucky to have some amazing speakers with us today. So feel free to ask questions, share your knowledge in the chat with us. Before we begin, I'll introduce our first speaker. Our first speaker is a highly trained nurse practitioner who is certified in both family and mental health care. She earned her Doctors of Nursing Practice and other advanced nursing degrees from schools in New Jersey and Pennsylvania. With over 13 years experience in family health and more than 3 years working in mental health and addiction, she has helped many patients in hospitals and pain management centers. She's also one of the founding members of Ghana Association of Medical Aid. Dr. Frimpong is passionate about teaching people how to stay healthy and prevent illness. Her goal is to work with patients, families, and community groups to provide quality care and support. So please, let's all welcome Dr. Josephine Frimpong.
Thank you. Thank you very much, everybody. Once again, good morning. My name is Josephine Frimpong. I'm a dual certified nurse practitioner in family medicine and psychiatric mental health. This morning, I'm going to talk about depression. Okay. Before I go on, I'll start with some statistics. It is documented that over 350 million people in the world are affected by major depression, and it's now becoming one of the major causes of disability in the whole world, according to World Health Organization. In 2018, a survey that was conducted ranked major depression as the third term of disease burden that is projected to rank first by 2030. That is a projection by World Health Organization. Again, in 2020, a research also conducted showed that 14.8 million US adults ages 18 and above had at least been or experienced major depressive episode with a severe impairment in the past year. According to CDC, they rate depression as much more higher in this age group, 18 to 29. And an average first depression episode appears within your teens to mid-20s. Okay. A national survey that was also conducted in 2023 reported that women are more likely than men, and younger adults are more likely than older adults to experience a depression. Personally, I believe that women have more higher rate of depression because women tend, and not being biased, women tend to follow with their providers and they are more vocal about their feelings, whilst men don't really talk about their feelings. So, of course, a survey will display that women are more likely to have depression than men. And also, it's been estimated about 39% of adults with major depression do not receive treatment. They don't go. So what is depression? Depression is also known as major depressive disorder or clinical depression. So if someone says depression, it's basically major depressive disorder or what we call the clinical depression. So major depression is one of the most common mental disorders in United States, as I mentioned in the statistics. For individuals, this can result in severe impairment and limit your ability to carry on with your daily activities. So depression is considered a mood disorder. Why is it a mood disorder? Because the patient or the client displays his or her inner feelings. When you come to psychiatry or mental health, mostly when we see our patients, we ask our patients to rate their mood on a scale of 1 to 10. Someone can say my mood is 4/10. One can say my mood is 5/10. One can say my mood is 8/10. The mood is actually the inner feeling the patient is expressing to you. So this scale that I gave, it's like 1 being, oh, you are very sad, 10, you are happy. So if you rate your scale as 3 to 10, that actually prompts me to do further investigation, ask questions, what is happening, can you describe your mood, so on and so forth. So this mood that I'm talking about, just like you and I, you can have a depressed mood today because of something happened. So you might rate your mood as a 3/4, over 10, but you're able to function and do your work. Maybe I see you the next 2 weeks because you were off or you had a vacation. You might rate your mood as a 7/10. Okay, I'm just trying to say that your mood can fluctuate, and if it fluctuates, it's okay. But if you have a persistent sad mood that continues over a period, then it becomes a problem. Also, based on the assessment of your provider, especially with, I would say an example, like with men, a man can tell you that my mood is 7/10, but the affect or what the person is displaying or what the person is portraying and what the expression the clinician is seeing on the person's appearance or on the face depicts something else. So always your mood has to be congruent with your affect. If you are displaying a sad mood, you display a sad affect. But if you are displaying a sad mood and you are happy, that is also a problem. Or it can happen that you are hiding something, and that also prompts your provider to do further investigation. So this becomes a disorder. Your depression or your depressed state becomes a disorder when your mood remains sad for a period of time and it affects your activities of daily living. Then it becomes a problem. So what is major depression? It's one of the most common mental disorders in the United States. For, like I just mentioned, for some individuals, it can result in impairment. You cannot do your daily activities of work. You cannot go to work. You are home. You just can't do anything. And when you present to your provider can actually see from the affect that you are displaying. You are disheveled, you are losing weight, you don't eat, you are unkempt, you have not taken a shower. All that plays a role. Your clinician making that assessment and based on that, conducting further investigation to diagnose you. So who is affected by depression? Depression is no respecter of person. Depression can affect a rich person, culture. Culture doesn't really matter. Your race doesn't matter. Age doesn't matter. Like I said, children are also, or teens are also affected by depression, but they display it differently. Gender, it can affect a man or a woman. Or you can be the one who is highly educated, but you can be depressed. What are the risk factors? Genetics plays a role. Biological plays a role. Environment, stress also plays a role. When I say genetics, it's been reported, or research suggests that genetics, if you have a relative a blood relative who has been diagnosed with depression, chances are you can also end up having being diagnosed with depression. Also, biological. There is a hypothesis that says that some brain neurotransmitters like serotonin, norepinephrine, dopamine play a role in depression. These are brain neurotransmitters that regulate your mood. Research is still ongoing, but research has purported that deficiency in these three neurotransmitters causes a person to be predisposed to depression. And that is the basis of how SSRIs were developed and how being used to treat depression. Environment. Your environment plays a role. Your social determinants of health. If you live in a war-torn country, always war, you don't have food, there's starvation, you are always stressed. Stress is on a higher level at every time. This plays a role. It affects your brain circuits that helps you deal with stresses. So this also plays a role. Your environment plays a role. Of course, stress and trauma. If a child, let's say a child has been exposed to a traumatic experience, that brain circuit again has developed. Your body can just take a certain amount of stress. Okay, stress is good for the body. It helps you build resilience, all right? But how much stress is too much? Okay, someone can be subjected to a stress that now they become vulnerable, as a child. This has affected the person. So if that person experiences the same stress as an adult, they cannot cope. I'm just trying to say that a stress level that person A can take is different to person B. Maybe person B has been exposed to this stress and hasn't been able to cope with it. So that effect is there. So when they become exposed to this stress again, it causes them to be depressed. Of course, a traumatic experience, death of a family member, death of a loved one, financial problems, marital problems, I can go on and on. That can also cause stress. What are some of the symptoms of depression? The DSM-5, which is the Diagnostic and Statistical Manual, it's a guide that mental health professionals go by in making diagnosis. These are some of the symptoms that they associate with someone experiencing depression. You have sleep disturbance. You can either be sleeping too much or you are not sleeping at all. Also, you are not interested in things that you used to be interested in. Like things that brought you pleasure, it's not even making you smile. That is a problem. You feel guilty about things that has happened in the past, and you are thinking you are worthless, you are of no importance. This is a symptom that is expressed by people with depression. You have no energy, you are sleeping all the time, you cannot even get up to do what you are supposed to do. You cannot concentrate. You cannot even concentrate to watch a television. Mind is just going from here to here. You are not attentive. You are absent-minded. That is the problem. Your appetite and weight changes. Like I said, you are eating too much. People say they stress eat. They eat too much. Some also don't eat. They lose weight. Okay. Some also are like, they are so zoned up in their own world that maybe they are walking and they are walking too slow. You can tell that something is going on, or they are walking too fast that you can tell that something is going on with this person. And number 8 is all patients with depression should be evaluated for suicidal risk. Right? If someone is experiencing depression, as the provider, it is very important you evaluate that person for symptoms of suicide. We have a scale or a tool that is used in making this assessment. So when a provider is going to make the diagnosis of depression or clinical depression, these 9 symptoms that I mentioned, 5 of them have to be present. And of course, 1 or more of these key symptoms should be present, meaning of all the symptoms, you are tired, you are eating, you are not eating, you are sleeping too much, or you are not sleeping, you cannot concentrate, you cannot focus, you feel guilty about yourself, you think you are worthless. These symptoms are present, but the major symptom that should be present should be you have a depressed or low mood, or you have lost of interest in things that you had pleasure or you enjoyed doing. It should be present. And these symptoms should have gone on for more than 2 weeks. That is, it should be on all day or nearly every day. You should be able to verbalize that these symptoms have been going on, or a family member that came with you should be able to say that this person has been experiencing these symptoms. He's not eating, he's not taking a shower, he's disheveled, he's sleeping all the time, he cannot focus, he's probably sometimes talking to him or herself. It's been going on for more than 2 weeks. Then your provider can go ahead to work on the diagnosis of you being depressed. Okay. There are some classes of depressive disorder. Like I said, depression can affect everybody. Some of these classifications are disruptive mood dysregulation disorder. This is basically like a disorder that is that teens are diagnosed with. When a teen is affected with depression, they sometimes their symptoms can include these 9 symptoms that I mentioned, but they display more of irritability and anger. They are angry all the time. They are fighting in school. They go to the playground. They are fighting. They come home. They are angry. They are irritable. You're getting complaints from school. They should go on for a year. And at these 3 places, it can be a home, school, basketball court. And then the provider can go on and say that this child has this diagnosis, which is also a part of the depressive disorder. You can have persistent depressive disorder, which they also call dysthymia. This is depression on and off for more than 2 years. And of course, premenstrual dysphoric disorder, which is a depression that comes on when females are about to have their menstruation. That is 1 week or a week and a half prior to the person having your menstruation. You have, usually we call it, someone is PMSN. This is premenstrual dysphoric disorder. That is due to hormonal imbalances, sometimes can trigger a person to be depressed. And person can also be depressed due to medical or clinical condition. Someone can be depressed because they have multiple sclerosis, a stroke, affected an area of what they can do before they cannot do. They're paralyzed, they have their limbs that are weak. They can't do what they used to do before. This can also set the person into depression. And a common feature of all these depressive disorders is sadness. You feel sad, you are empty. Like I said, with the children, they are irritable, they are angry, they are fighting in school, they are not focusing, they are getting in trouble. School, at the park, at their after classes, they are getting angry, they are fighting, they are threatening people, they are irritable. And like I said, the classic symptoms of all, which is common to all these depressive disorders, is you're feeling empty. It's accompanied by somatic or cognitive changes. You cannot concentrate. You are sleeping all the time. You are getting into trouble. You feel like you are worthless. Okay, so when you experience these symptoms, or when your provider sees these symptoms, they can screen you with a validated tool. And even not when you are experiencing these symptoms, but when you do your doctor's visit, um, it is part of the regulation for your provider. It can be a mental health provider, it can be a primary care provider to screen you for depression. And one of the screening tools that they use is what we call the PHQ-9 screening tool. It has questions basically asking you about these 9 symptoms that I mentioned, and it's a scale. Based on the scale, so if your provider asks you for the last 2 weeks, how often have you been bothered by the following? And they go ahead and say you have lots of interest in things that you used to be interested in. On a scale, they have a scale that is the same for everybody. It's either not at all, or you're displaying this several times of the day, or more than half the time, or nearly every day you are experiencing this. So if your provider asks you this question and you say, oh, nearly the last 2 weeks, I've been having lots of interest in things that I used to be interested in. It's on a scale of 0 to 3. If you say nearly every day, your provider checks 3. You feel down, you feel depressed. Is it nearly every day, several days, more than half the days? If you say, oh, nearly every day, the provider checks 3. So at the end of these 9 questions, there's a score. Whatever your score is how your clinician or your provider will make his judgment in providing your treatment. Okay. Also, when you're having these symptoms, it must affect you in such a way that it impairs your daily activities of living, meaning you are so depressed you cannot get up and go to work. It's affecting your job, it's affecting your family, or someone can be having these symptoms, but the person can still get up and go to work. That determines how severe the person's depression is. So based on that, your clinician will make, or your provider will make the scoring and decide on the treatment for you. You can have a mild depression, you can have a moderate depression, you can have a moderate to severe depression, which your clinician might decide to say, oh, then you need therapy. You need therapy together with treatments. You have severe depression, and your clinician will screen you for suicidality because you are severely depressed. I leave you to go home. Something else can happen and you might be blamed. Your provider could decide to start you on medication and psychotherapy. Also, this same tool can be used to assess your progress. Your clinician has started you on medication, you come back to visit. Your clinician can go through the same tool and assess how you are doing. Okay. So before this diagnosis and treatment can be initiated, your clinician has to go further and interview you, find out if you have a relative has been diagnosed with depression, like conduct a medical interview. What is your medical history? What is your past medical history? Are you using any substances? Because people are depressed using other substances. Are you using any substances? Are you have you experienced any trauma? Have you been abused physically, sexually? What is your living standard? Are you homeless? Are you eating? Where do you live? Are you working? Are you unemployed? When has it been? Your education? They ask you all these questions. And after that, also, your clinician will do a physical examination. They look at you, your eyes. Are your eyes bulging out? Are your thyroid swollen? Your hair thin? Your skin? Look at everything. Are you disheveled? Are you dressed well? Are you brushing your teeth? All these will be taken into consideration as well. There are lab orders that are also ordered. You can go ahead and do a CBC, a BMP, you screen for thyroid hormones, screen for ABJ. Are you being exposed to something at home that is changing your mentation? All these come into play. Vitamin level, they check all that. Also, is it because you are having a tumor, or is it because there's a lesion somewhere in your brain? You can have images done, such as a CT scan, you can have an MRI, your provider can do all these. It's a whole picture before this diagnosis is made. Okay. What are some of the treatments for depression? Like I mentioned before, there's a hypothesis for the cause of depression. It can be genetic, biological, environment, but it's through the biological hypothesis that certain medications were made to help treat depression. One of the first line of treatment is what we call SSRI, the selective serotonin reuptake inhibitors. These are a group of medications, about 5 medications. I'm sure a lot of you have heard about their name. We have the Prozac, Zoloft, Celexa, citalopram, paroxetine. All these medications are what we call the SSRI. These medications were developed to help people who are depressed. It is believed, like I said before, the hypothesis is that there's a deficiency in the brain neurotransmitters, mostly serotonin, norepinephrine, dopamine. So these SSRI, because they are serotonin reuptake inhibitors, make, in a nutshell, serotonin more available in the brain chemistry, so that your depression level is reduced. Someone will say, okay, so which one am I selecting from the about 6 medications? These medications all work differently. Even though they are all SSRIs, it is believed that they all work differently in different parts of the brain to help with your depression. It's medications like Prozac can be given to teens. It can also be taken by adults, females, and it's supposed to be safe. That is why it's the first line, because of little side effects. There are other medications that when you are on treatment for depression, you cannot take certain foods, and it interacts with other medications. So the SSRIs are the first line. There are other medications such as the SNRIs, which like an example is a Cymbalta or venlafaxine. Based on your symptoms that you are experiencing, you're to use one of these medications. Like if you have pain and you are depressed and all that, your provider can say, okay, I'm going to use Cymbalta because it has qualities of helping with pain. Okay, so they can make that choice and also add psychotherapy to it. We have other atypical antidepressants such as Wellbutrin, Remeron, Trazodone. Your provider can again decide to use this medication. These medications it's either they are all working to bring up dopamine or norepinephrine. This Wellbutrin sometimes is also used in clients with ADHD. On the other side, it's used for smoking cessation. We have Remeron, which is also very good because if you are not eating, if your provider make the assessment and see that, so you are not eating, you are not sleeping, okay, I'll give this person Remeron because the side effect of it is, it makes you drowsy, and in the morning you are very hungry and you will eat. Okay, you cannot sleep, they can choose to use trazodone or help with your depression and again make you sleep. There's also psychotherapy. Like I said, trauma plays a role, stress plays a role with psychotherapy, and I know Dr. Swift is an expert in this. It's mostly teaching you how to do better problem solving, how to set realistic goals that you can achieve, talk to you and kind of make you think differently. That could decrease your stress level and help you cope, because that is the goal at the end of, you know, what we are looking for. Treatment is supposed to help the person or restore the person's normal function. That is the goal here. We have other somatic, there are other somatic treatments like those who cannot, who are not responding to SSRI because like we are not all the same. Like I mentioned before, some have persistent depressive episode that it is ongoing, they are suicidal, they are of a danger to themselves. Treatments such as the ECT, electroconvulsive therapy, can also be introduced to these kind of patients. This is like under a supervision of an expert. There are brain waves that are sent to kind of create like a convulsive activity. It is believed that this will kind of boost the brain neurotransmitters and help with your depression. There's also transcranial magnetic stimulation. It is also another form where a magnet is placed on your skull to send waves to different areas of your brain to stimulate the levels and kind of boost your neurotransmitters to help with your depression. So in a nutshell, depression is dangerous. It's causing, it can cause fatality if it's not treated. So if you have a family member or a loved one or a colleague who is displaying the symptoms that I mentioned before, loss of appetite, not interested in things that they used to be interested before, they are irritable, they are verbalizing that they feel worthless, you are seeing them disheveled, not sleeping, cannot concentrate. Sometimes when it's severe, they have hallucinations. Just seek help or advise that person to seek help and get treatment. Thank you very much. At this time, I will yield to the second presenter. Thank you.